ups and downs, constant ups and downs. Am I happy? Am I sad? Or am I just confused? Today, I'm going to talk to you about mental illness you guys have probably all heard of before, bipolar disorder. We're going to go over what it is, the history of it, and its treatments. Also, first we'll talk about what it is. Also known as manic depressive disorder, it is according to webmd.com, it is a chronic mental illness, and it can also be genetic. It causes major highs and lows in a person's sleep, energy, thinking, and behavior. And the word manic describes like overconfidence and excitement, which can also cause irritability and impulsive decisions. And some people who suffer from bipolar disorder can also suffer from delusions and hallucinations when they're in the middle of a manic episode. Manic versus depressive symptoms, or the highs and the lows of bipolar disorder. Manic symptoms are less common than depressive symptoms, and doctors tend to separate the two into two different categories. Manic symptoms can include poor concentration or grand and unrealistic plans, rapid speech, restlessness, increased energy, excessive happiness, hopefulness, or excitement, irritability, anger, and hostility, insomnia or less need for sleep, drug and alcohol abuse, and most importantly, poor judgment or impulsive thoughts and actions. The second side of bipolar disorder is the depressive symptoms, or the low side, which can cause sadness, loss of energy, feeling hopeless or worthless, uncontrollable crying and emotion, trouble concentrating, insomnia, and most importantly, thoughts of death and suicide. Next, we'll talk about the history of bipolar disorder. According to healthline.com, records of bipolar disorder go all the way back to the 1st century in ancient Greece, where they discovered lithium salt baths can control the symptoms of people who suffer from bipolar disorder. And lithium is actually a chemical that's commonly used in medications to treat the disorder today. And many years went by when they didn't discover anything new until French psychiatrist Jean-Pierre Faure in 1851 wrote an article talking about the switching from manic symptoms to depressive symptoms, and it was also the first documented diagnosis, and he was also the first doctor to discuss the genetic aspects of bipolar disorder, which is something that doctors still believe today. And lastly, we will talk about the treatments for bipolar disorder. According to MayoClinic.com, bipolar disorder, a lot like most mental illnesses, is a mental illness that still no longer has a cure, but can be monitored with prescription medications and long-term therapy. Although these medications can help, they can have very serious side effects, and most people who suffer from bipolar disorder, first medication usually doesn't work. It's a lot of trial and error and going back. And most people who suffer from bipolar disorder have to have frequent doctor visits to make sure your mood is being stabilized. And yeah. Group and individual therapy is also recommended for people with bipolar disorder, so you can talk to people who also understand what it's like. So today, I introduce you to what bipolar disorder is, the history of it, and its treatments. I hope you guys learned something new and it helps you guys look at people with mental illnesses just a little different. Thank you.